Diep Flap stands for Deep Inferior Epigastric Perforator Flap, and it's actually the preferred method of breast reconstruction at PRMA. It uses the skin and fat from the lower tummy region, kind of like a tummy tuck, to reconstruct a warm, natural, soft breast. The skin and the fat from the lower tummy is basically disconnected from the body and transplanted up to the chest and reconnected using microsurgery. The main benefit is that all the abdominal muscles are preserved. Unlike the traditional techniques such as the TRAM flap, the abdominal muscles are completely left behind and only skin and fat is moved. The recovery is also much easier when you save the muscle. Patients have less pain and they stay in hospital for less time, generally speaking. The Diep Flap is a very successful procedure. It's 99% or more successful. Once the procedure is done and completed and the reconstruction is completed, most women are exceptionally happy. They don't have the typical results that are associated with a breast implant reconstruction and the problems that go with the implants. The cosmetic results are far superior if we can do the reconstruction at the same time as the mastectomy. Most patients also love the fact that they get a tummy tuck out of the procedure too. The vast majority of women that go through this have had children. They've got some extra tissue in that region, and they're very happy to get the benefits of the body contouring aspect from the reconstruction too. Nationwide, there are probably only about 40 plastic surgeons that perform Diep Flap breast reconstruction routinely. All our surgeons have extensive experience with microsurgery, and in terms of our cumulative experience, the practice has probably over 100 years of experience in terms of advanced plastic surgery procedures, microsurgical reconstruction. At PRMA, we perform hundreds of Diep Flap breast reconstructions every year. In fact, this year we're on track to perform over 500.
I first heard about PRMA through a woman in my support group. She had the reconstruction. She invited me to her house, and my husband and the kids, we went to her house, and she went through what she went through at the time, and my husband and her husband talked, and then she showed me her reconstructed, and she did one and the other one was original, and I could not tell the difference between the two. I'm very happy with my result. I can wear swimsuit. I don't have any limitations. I mean, if I choose to, I could run a marathon. I can do sit-ups and all that sort of stuff. I go swimming, and you can resume your normal activity.